Hello, my name is Dr. O'Leary, and I'm here to discuss the events that occurred while Mrs. Romanoff was in my care. A little history on Mrs. Romanoff. She was admitted to the hospital with intense pain and complaints of decreased fetal movement over the last 2 days. The patient was not currently dilated, nor was she in active labor. Dr. Baxter was her primary OBGYN. However, she was tied up in another emergency and could not see the patient for some time. Therefore, I, Dr. O'Leary, and Dr. Feldman were caring for the patient at this time. Mrs. Romanoff was due June 23rd, but a recent ultrasound showed that she was much further along than originally thought. She was seen in the office by Dr. Baxter and instructed to come back in 1 week if she was not currently in labor. The patient began experiencing intense pain with decreased fetal movement and was admitted to the hospital. In the ER, it was found that both mom and baby were experiencing decels and bradycardia. Dr. Feldman was to see the patient, but prior to going in, he was called for an emergency delivery and needed to be in a different room. He sent in a med student who immediately realized that something was terribly wrong. The med student called Dr. Feldman, and the patient was rushed to the OR to have a C-section, which was to be performed by myself, Dr. O'Leary. The patient arrived in the OR in distress. Dr. Feldman began to express his concerns, which I regretfully dismissed as the situation was urgent and I felt that it could not wait. The anesthesiologist was at the bedside and notified me that a spinal anesthetic had been administered, however, it had not become effective yet. The anesthesiologist requested a few more minutes to see if the effects would become present. However, the situation was emergent and I did not feel that the patient could wait any longer. I instructed that a general anesthetic be given. Again, the anesthesiologist requested a few more minutes to see if the spinal would become effective. I denied him this request. The anesthesiologist again made another request to confirm a patient's airway prior to surgery being started. I denied him this request again as the situation was urgent and stat, and I felt that it could not wait as mother and baby were in terrible jeopardy. The patient was a class 2, and I regretfully look back and realized that an airway should have absolutely been confirmed prior to the start of surgery. I started surgery, and due to complications, an airway could not be obtained. A code team was called. The code team was delayed due to no room number being given during the call. When the code team finally arrived, the baby was extracted from mom and taken elsewhere for assessment. Meanwhile, I stayed with the patient and we tried to obtain an airway so that ventilation could be performed. However, due to decompensation and complications that arose, the patient did not make it. Those are my recollections of what happened during my care with Mrs. Romanoff.